Today's video topic is double chin. Double chin is also known as submental fat. It happens when a layer of fat forms below your chin. It is usually associated with excessive weight gain, but that is not the case all the time. It can also be caused by genetics or looser skin that results from aging. There are a lot of things to do if you want to get rid of your double chin. Exercises that target a double chin. These 6 exercises can help get rid of a double chin by strengthening and toning the muscles and skin around the area. The exercises should be repeated. Make sure you consult with your doctor before trying a new exercise. 1. Straight jaw jut. Tilt your head to the back and look toward the ceiling. Push your lower jaw forward till you feel a stretch under your chin. Hold for a count of 10. Then relax your jaw and return your head to a neutral position. 2. Ball exercise. Place a 9 to 10-inch ball under the chin, then press it down against the ball. 3. Puker up. Tilt your head to the back and look at the ceiling. Pucker your lips as if you're kissing the ceiling to stretch the area beneath your chin. Then return your head to its normal position. 4. Tongue stretch. Look straight ahead and stick your tongue out. Lift your tongue toward your nose. Hold for 10 seconds, then release. 5. Neck stretch. Tilt your head to the back, look at the ceiling, then press your tongue against the roof of your mouth. Hold for about 5 to 10 seconds and release. 6. Bottom jaw jut. Tilt your head to the back and look at the ceiling. Turn your head to the right. Slide out your bottom jaw for 5 to 10 seconds, then release. Turn to the left and repeat the process. Eliminating a double chin through diet and exercise. If your double chin is caused by excessive weight gain, you can get rid of it by losing weight. The best way to go about this is by eating healthy and exercising regularly. Some healthy eating guidelines are: eat more fruit and vegetables daily. Avoid processed foods. Eat lean protein like poultry and fish. Replace refined grains with whole grains. Eat healthy fats. Eat low-fat dairy products. Stay within your daily calorie needs. Treatments for a double chin. If your double chin is caused by genetics, your doctor may recommend invasive procedures. 1. Lipolysis. This is also known as liposculpture. It involves the use of liposuction or heat from a laser to melt away fat and contour the skin. In most cases, all that's needed during lipolysis to treat a double chin is a local anesthetic. Side effects of lipolysis may include bruising, pain, and swelling. 2. Mesotherapy. Mesotherapy is a minimally invasive process that delivers little amounts of fat-dissolving compounds through a series of injections of deoxycholic acid. Treating a double chin might take about 20 or more of these injections per treatment. Only a dermatologist or a doctor that is knowledgeable about the drug should give these injections, because if they are injected improperly, they can cause serious nerve damage. Potential side effects of deoxycholic acid and other mesotherapy injectables are bruising, swelling, pain, redness, and numbness.
Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.